evening, everybody. Welcome to tonight's live stream, which is going to be on antibiotics and then the probiotics and how it all affects the gut microbiome. So I'll answer any questions on antibiotics, from can you drink alcohol with them to do they make you drowsy, and then moving on to should you then take probiotics if you have taken antibiotics, and any general questions on probiotics and prebiotics, and some way onto nutrition, but nutrition isn't my expertise, so I'll leave it just on the antibiotics. So welcome everybody. If you can say hi in the chat, that would be great. Put your questions in the chat. For those that are on replay, if somebody doesn't ask your question or I don't cover it in this live stream, you can still put your comment in after this stream's gone onto the main platform, and I will do my best to keep an eye on any comments and answer them after the live stream for you. Or even if there's a lot of questions, may even do a second live stream to this. From the poll that I had done saying what you wanted for the next lot of live streams, there was also interest in me doing a live stream for laxatives, so that's what I've got planned next time, as well as for PPIs, which may be for a future one. I will cover it a little bit today because PPIs do affect the gut microbiome, but I can do PPIs maybe as a standalone video. So hello, hello Mr. Ranger Lab. Hopefully it will be an interesting topic for you all. It's probably the thing that I get asked the most on private messages, people asking me about sort of antibiotics and can they still drink. Welcome Julie. Welcome Amanda. Great to see you all here. Oh, yeah, so the probiotics that they add, yes, the different strains of gut bacteria, and yes, and are they still effective when they're in yogurts? Yeah, I am going to move on and answer all of those questions later on. So, yeah. Before I start, I will have to make sure that I do my disclaimer, so I'll just run through that. So please take this live stream as information for educational and entertainment purposes only. Don't be asking for personal advice on here. Always go to your own healthcare provider. Obviously, I am a UK pharmacist of 20 years, so everything I will be saying is mainly on the advice that's given to UK GPs and consultants, and the legislation and the antibiotics and products that we have available here in the UK. But I am sure you'll all have similar in different parts of the world. Antibiotics is something that is readily available across the world. In fact, the UK probably has stricter rules than the majority of places, because we have to have all antibiotics on prescription, whereas quite a few parts of the world you can actually buy certain antibiotics over the counter. I'll also just run through the intro. So if you could like, comment and subscribe, that all helps the YouTube algorithm. I'm at 448 subscribers, which is nearly there to that first threshold of 500 subscribers for the first tick for the YouTube, except for I am still nowhere near the 3,000 hours of watch time. I really need to get more videos on the platform so that my subscribers have more things to watch. Okay, let me go back to the comments, see if there's any. Try and keep up to date with that. Yeah, Julie, almost at 500. Hello, Laurie. You haven't missed anything yet. I've just done the normal introductions, so I haven't actually started on the subjects yet. So yeah, when I get to 500 subscribers and 3,000 hours of watch time, I'm then able to join the YouTube's affiliate program, where I can then set up being able to do super stickers and memberships and such like on the platform. I'm not sure how much of that I'm going to do, because I don't really want to be taking money off my subscribers. I want to be able to provide free advice. So I'm mainly still aiming for the YouTube 1,000 subscribers, where I can then get the money in through the AdSense, make the money from the adverts from the big companies, so that I can spread the information free of charge to other people. So still a long way off, but I've done amazingly. I set this going live in January with a trial video. Didn't really start until April with actual pharmacy content, and already within a year I've got to nearly 450 subscribers. So yeah, I've done brilliantly, especially seeing as this year I've also managed to get very busy with work and life, and then I have been ill recently. So I have been ill with a virus that knocked me for six over a month ago. It then left me with, well, they said it was post-COVID, long COVID, but I don't know whether it was COVID I had. And then I got a bacterial infection on top of it. So I'm all used to what antibiotics are, and back to now having yet another viral infection. So sorry if I end up having to just go off screen for a couple of seconds during this. So antibiotics, they're probably one of the main drugs that have had such a major impact on public health over the last century. So yeah, before antibiotics, people were suffering and dying of many illnesses that now we can just treat so easily. So many chest infections and pneumonias never got treated and would cause significant problems. And because they weren't treated, they would then spread, because bacteria is great at spreading. And so it was a major public health revolution, especially when penicillins first came out. And unfortunately, they did then get to the point of probably being overused. And due to the overuse, you're probably all aware now that actually we are now getting bacteria out there that are resistant to antibiotics. So we now have what we know as the antibiotic resistant bugs. So you've probably all heard of MRSA, which is methicillin resistant Staphylococcus aureus. Methicillin is just basically a type of penicillin that they do the test with, but it basically means that they're not all penicillins it's resistant to, so they can no longer use penicillins to treat MRSA. So you need to be going on to second, third line, and even fourth line drugs. There is also the ESBLs, which is the really bad bacteria that can cause urinary tract infections and kidney infections, that is not responding to the first and second line treatments for them, and will often require drugs that are antibiotics that can only be given by IV infusions. And then the big one, which is probably the topic of today's with going on for the gut microbiome, there is C. difficile, Clostridium difficile, which is a bug that normally lives in many people's guts quite happily, just in small amounts. Our normal gut microbiome keeps it in check. But if you have course of antibiotics, it can really take over, and it is pretty horrendous. It's one of the most horrendous bacterial gastro infections that you can have, and it can be pretty difficult to treat. There's only a couple of antibiotics that can actually treat it. So with these sorts of infections, whenever anybody gets diagnosed with MRSA, ESBL or C. difficile, Public Health England need to be aware. They track that in all the hospitals. All the hospitals are tracked for the levels of these. And one of the things that is known is that it's the broad spectrum antibiotics that are more likely to mean that those three antibiotics, those three bacteria take over and are more prevalent. So then there is instructions and guidelines out there, and also targets to make sure that people use appropriate antibiotics and in the correct guidelines, in the correct quantities and timeframes. So, yeah, thanks, Laurie and Ollie. Yeah, I've been sick. It's been a bit of a pain. So obviously I did definitely have a viral infection, and as a lot of people, and this is one thing that happens, a lot of people get viral infections, and these viral infections can be pretty horrendous. People who maybe had the original couple of strains of COVID now, people who have had true influenza now, that it can be really bad. Obviously, there's a difference between just a normal rhinovirus cold and some of the more significant ones. Plus also people that maybe have a reduced immune system or other long-term conditions alongside, where their immune systems take a longer time to get back on top of things. Even a simple viral infection can make them feel bad. Fortunately, there isn't many antivirals out there for treating, although in England, we have just reached the threshold for the amount of influenza that's in circulation, that for people who are immunocompromised or have severe chronic conditions, if you do get diagnosed with influenza, there is an antiviral out there for you. Brand name Tamiflu. I don't really recommend it unless you really do need that extra help, because it only really reduces the symptoms of the viral infection by about 12 hours. So for the majority of people, that's neither here nor there. But obviously for somebody who is immunosuppressed or such like that, could be the difference between that 12 hours of getting them hospitalised or keeping them out of hospitalised. So that's where it comes in useful. So, yeah, so the majority of people, they have viral infections, they go to the GP and the GP goes, yeah, I've checked you all, it's viral, go home, drink plenty of fluids, take some paracetamol, rest up. And then a week later, they end up with a bacterial infection on top, end up going back to the GPs and end up needing, or even going to out of hours or A&E, and ended up with antibiotics. And then they often want to have a go at that previous GP for not prescribing antibiotics in the first place. Unfortunately, that first GP was correct. The majority of times a viral infection will get better on its own. It's only in certain people at certain situations where it will then progress with a secondary bacterial infection getting on top. And there is no point treating with antibiotics until that bacteria has actually taken over. There are people out there that want to take the antibiotics prior to the bacteria taking over and trying to prevent it, but that actually just increases the risk of bacterial resistance in the future. So, yeah, you do actually have to wait until you know that there is the bacteria taking over. So, like where we go from a viral sore throat through to tonsillitis. Well, it's a viral sore throat where it's really red, really sore, you're feeling pretty horrendous, but while it's like that, there is no point taking an antibiotic. Not until you get to the point where the bacteria is obviously getting to the point where the bacteria cannot be killed off by your own immune system, where there is the white pustules, you've got a searing temperature that you can't keep control of, you've got the shivers, you've got the shakes, and it's getting towards it becoming a systemic infection. That's when you need the antibiotics. So it can be a very fine line for doctors to know which people who have got a viral infection are going to go on to develop a bacterial infection, and that does put them in a very hard spot, especially last thing on a Friday afternoon, is this patient going to last the weekend without it turning into a bacterial infection over the weekend? And obviously you've got to then weigh up the choices of, do we give a prescription and tell a patient to only take it if certain symptoms happen or not? So this is a balancing act of trying to keep the trying to keep the amount of antibiotics used out in the public down to prevent antibiotic resistance, but also preventing serious bacterial infections that could put people in hospital, especially the most vulnerable. Hello, Mum and Dad. Nice to see you online. Hopefully the cats will come and visit you today. So that's sort of just a bit of needing the antibiotics. Now, when it comes to antibiotics, there's two main amounts. There's what we call the narrow spectrum, which usually only attack one type of bacteria, and then the broad spectrum, which attack a lot of different bacteria. So when it comes to treating infections, we could really do with making sure that we stick to the narrow spectrum ones that only attack one type of bacteria, rather than attacking all bacteria. That way that you're not going to lose as much of your gut microbiome, you're not going to cause as much bacteria resistance and such like in the future. So the majority of times it's best to stick with a narrow spectrum. Now, the first and main amount of narrow spectrums are the penicillins. Depending on the type of penicillin, depends on which part of the body. So like flucloxacillins quite often for the strep infection, for the staphylococcus infections that are on your skin. Amoxicillin, penicillin are more for your streptococcus that are in your nose and throat and into your chest. And so having those is best. Now, this comes up with the subject of penicillin and allergy and what's the difference between a side effect and an allergy. And we do know that there's a lot of penicillin allergy out there, but we also know that only 10% of people that have got penicillin allergy on their notes are still truly penicillin allergic. Some people can be penicillin allergic as a child and actually grow out of it. Some people have been misdiagnosed as penicillin allergy when they only actually had a side effect, not an allergy. And so it can be worth making sure that it is a true allergy, especially when you're needing quite a lot of different antibiotics all the time, so that you're not losing the amount of different antibiotics that you can try. So, hi Sam, great to have you here. Penicillin allergy for real, yeah. And it is always worth stating, if you have a penicillin allergy, when you actually tell the GP or the health professional, actually explain to them what your allergy was, so that they definitely record how allergic to penicillin you are. So there is quite a lot of people out there. So pretty much every antibiotic that you take does cause some GI upset. And that's because it's affecting your gut flora. It's getting rid of some of your good bacteria. So pretty much everybody that takes a course of antibiotics may end up with diarrhea and may even have nausea and even sometimes vomiting. And that is actually normal. There's even some antibiotics like erythromycin that actually increase the way that your gut peristalsis works and increases that along. They actually use it post operations to get your gut to switch back on. So like erythromycin will definitely cause diarrhea because it's actually one of its actions is to be gut motility. So having diarrhea, nausea and vomiting as a reaction to an antibiotic is not an allergy. It is a side effect, and therefore you could potentially have it again, as long as you also know that you may have to have just double check that about the dose, whether you need to actually take other medicines alongside that. Then there's the case of having a rash to an antibiotic. Now, there has been that, yes, a lot of the times having a rash to an antibiotic can mean that the next time you take that antibiotic, it turns into an anaphylactic reaction. However, a lot of children and even sort of teenagers who are treated with penicillin as a child, especially when there was also an underlying viral infection at the time, there is a known side effect that giving penicillins in a child that has a viral infection will get a rash. And it's actually the viral infection's reaction to the penicillin that is causing the rash, and not actually a penicillin allergy. So there is the potential for children that have had a rash to penicillin, if when later in life, if they are needing lots of different antibiotics, they could potentially actually have that tested. But obviously this would need to be tested in a controlled environment, where if it was then to turn into an anaphylactic reaction, it would then need to be then documented to not give any more doses than there is anaphylaxis. Obviously, anaphylaxis reaction to any medication is a definite do not give again. There is potential for seeing an allergist and having a full range of tests to see exactly which ones you are allergic to. But anaphylaxis, any swelling of the throat, any swelling of the tongue, affecting the breathing and such like, and requiring A&E hospital, anything like that with anaphylaxis, definitely always make sure that that's written down and documented every time you go. Some people, if you've got multiple anaphylactic reactions, it can be worth getting either one of the bracelets that says that you're anaphylaxis, or a necklace that says you're on anaphylaxis. You can even get apps on your phone that can store your medical history and say about your anaphylaxis and such like. So I'm just going to go back on the comments on here, because I think everybody got quite excited telling me how many people are allergic. So yeah, anaphylactic shock, you make sure that's documented at all times. There is a lot of people can actually grow out of allergies and grow out of penicillin allergies, and there is doing a lot more research now on sort of the potential for people to be desensitized and grow out of allergies, and it's worth doing for many different things, not just penicillin, for other medications and for foods. Obviously in a controlled environment and under the support of an allergist, I would always say, not something to just try at home. MRL. Have to remind me what I said that was MRL. I've lost what that accurate in. Erythromycin, it can make you really sick. Now, because it makes you really sick, it's worth documenting that you have that side effect for erythromycin, but that doesn't then mean that you can't have any of the other macrolides that are in that group. So you've got erythromycin, and erythromycin is the worst one for causing GI problems. But there is also clarithromycin and azithromycin, and they may not make you as sick. So when you put it down, it's a side effect to erythromycin, but you still could potentially have the other macrolides, and you've still got them options out there for future. That probably doesn't sound too good, although I would also say, what else were you being given at the same time? Were you also being given something like codeine or morphine along at the same time while you were ill? So there could be other things, and that's the other thing that goes along with side effects and antibiotics, is you're also really quite often really ill with a bacterial infection at the time. So you've also got to find out, was it any symptoms of the progression of your infection, or any of the other medications that you were giving at the time to try and treat? Alec came out with a rash, but as I've just said, he possibly could end up with anaphylaxis. Luckily, he's always fairly well and doesn't need antibiotics, but if ever in the future he does need lots of antibiotics, he could get retested, and it may no longer be allergic. But luckily he doesn't get very ill very often, so that's good. Hi Patricia, great to see you. Hi DC, you're not that late. I've only just started. I've still got lots to go. Mr. Angel Lab. That will explain that. Yeah, so yeah, there has been quite a few articles. I could hunt it out and look later on. It's not one that I remember off the top of my head because it's just gone into the file of information that's classed as good now. So, hi Shelby, good morning. So I'm assuming you're one of my US peeps because, yeah, it's evening over here in the UK. So, oh, hi. Great to see you all chatting in the stream. That's brilliant. So, as I was going on, sort of, when it comes to side effects of medications, people have come along and said many different side effects to antibiotics, but quite often you're going through a really bad infection at the time, and that can mess with you, especially if you've got a temperature. That can mess and give a lot of side effects. Usually antibiotics do not cause any side effects such as drowsiness or anything in the sort of passing in the blood-brain barrier and causing anything sort of that affects your central nervous system. However, bacteria does. And yeah, when you have bacterial infections, you can hallucinate and think of things. I remember when I had one and I was out of it for about 48 hours and I thought I had angels in my bedroom with me, which I could hope that they were angels there with me, or I could have just been hallucinating. I could embarrass my mum on telling her hers, but I won't do. But yes, people can have all weird and wonderful, which then fetches me on to the, can you drink alcohol with antibiotics? This is a question that I am always getting asked. And in the majority of times, I would say, why have you been given antibiotics? If you are ill with the bacterial infections to the point that you have needed to get antibiotics, then I would say it's probably not a good point to be going out and having a drink. You need to be staying, resting at home, getting plenty of hydration with non-alcoholic fluids and taking care of yourself. However, if you've been given a course of antibiotics, maybe long-term, maybe to prevent future infections, such as preventing UTIs, being given a low-dose antibiotic, or maybe you're having a course of antibiotics at a low dose for treating acne, for the majority of times, the majority of those sort of antibiotics, they do not have an interaction with alcohol, and you should be fine having alcohol alongside it in a reasonable amount of, in a sensible amount of alcohol. Obviously, I don't encourage binge drinking or such like, but there is one antibiotic that you must never, ever, ever drink alcohol. And it does say in bold letters on it, avoid alcohol. And this is metronidazole. It's also known as Flagyl. So I think the majority of people in America know it as Flagyl. It is often used for dental infections, bowel infections, and gynae and STI infections. So that's metronidazole, Flagyl. And it's what we call has a anti-abuse side effect. So there's a drug out there called Antibuse, I'm just trying to think of its other name, that you use to treat alcohol addiction. And basically, if you take metronidazole at the same time as alcohol, it gets in the way of the alcohol metabolism. You get a buildup of the alcohol, one of the alcohol metabolites. It increases the blood flow into around your body. It causes flushing of your head, neck and face, and a severe headache to the point where you can actually become unconscious and require hospital admission. And so it is a definite metronidazole, Flagyl, never ever drink any alcohol with it. But it's usually, for severe infections. So you'd probably, severe dental infection. And although, yes, when you've got severe toothache, you might want to have some alcohol as pain relief. No, just don't. I have to agree, DC. Yeah, you are such a kind human. You have been so great in helping me. So yeah. Yeah. So I do have a bit of a metaphobia, so I'd prefer not to know that. But yeah, so obviously, at some point, if you have a GI side effect to a drug that is pretty severe, as in the fact that you're not going to keep down the medication, then yeah, it's not going to be productive. So that is something that you need to do. A severe side effect, and that, but as I said, you may be fine with the azithromycin, which is a sister drug, may not cause that same side effect for you. So yeah. Now this is the thing with antibiotics. We don't technically have weak and strong antibiotics. We have antibiotics that target certain bacteria, and they either go for a small amount of bacteria or a large amount of bacteria. When it comes to actually the flagell metronidazole, it actually goes for only one specific type of bacteria, and that is anaerobes. And anaerobes are bacteria that don't like oxygen. So that's why it's the bacteria that live deep in the jaw, deep in the intestines, or deep in the uterus and such like. So yeah, so that is the problem. But there is an alternative to that, which is a broad spectrum antibiotic, which I'm going to come on to, which is coamoxiclav, which is amoxicillin with an extra ingredient. That means that the reason why penicillin, a lot of bacteria are resistant to penicillin, is because they have a cell wall that's resistant to it, and it breaks down that cell wall so that it can get in an attack. So so you've got what we call the broad spectrum antibiotics. Now that covers all the cephalosporins. So they all tend to sort of cefalexin, cefuroxime. So all the cephalosporins, they treat a lot of things from chest infections to UTIs, many different things, because they kill a lot of different bacteria. The quinolones, so ciprofloxacin, ofloxacin, levofloxacin, and then coamoxiclav. And these are all classed as the broad spectrum antibiotics. And these are the ones that actually are the most likely to knock out all of your good bacteria. So although they'll be hitting the bad bacteria that's taken over your body, they'll also knock out all your good bacteria. And then that's the reason why they then can be problematic in allowing the antibiotic resistant bacteria, such as your MRSA, your ESBLs, and your C. difficiles, to take over. Because then once everything's out your system, those three, they're the first to like to take hold and get back on board and get straight back on it. And so a lot of times that is why C. difficile is often usually after somebody's had a big course of another set of antibiotics for another infection, that they then get C. difficile after afterwards. And it's one of the most common infections sort of for hospitalized patients, C. difficile. Oh, Levaquin. I don't know what that brand name is. I'm assuming that's the quinolone levofloxacin, but that's just a guess. And if so, that's a quinolone, which is a broad spectrum. I've got some data on this. So yeah, so obviously having your antibiotic kills all your good bacteria and can be bad. So I've got an article to show in a bit about sort of whether to take probiotics afterwards. Oh, thank you so much. So can you take probiotics and antibiotics at a time? I will cover that. And just one more thing I wanted to cover before I jumped onto the gut microbiome and thing was oral contraceptives. So there's always been the myth gone around that antibiotics interact with oral contraceptives. Now, again, like with the alcohol myth, there's some truth in it because there is a very few amount of antibiotics that do interact with oral contraceptives. And again, they're usually always labelled. And these are actually usually ones for very severe infections, such as treating things like tuberculosis, not something that's usually used on a general day-to-day basis by GPs. It's usually a third or fourth line agent and for specialist people. So the majority of times, the oral contraceptive isn't actually affected by the antibiotic. However, there is a good chance of oral contraceptives being affected by your bacterial infection or by the side effects of your antibiotic. So a lot of times, if you've got a bacterial infection, you're very ill, you're not staying hydrated, you're not staying with your normal eating habits, and along with that, your normal daily taking of your oral contraceptive may not be as regular and as correct as possible. So there's more chance of the fact that you've had a missed pill because you were too out of it one evening to remember to take the pill before you went to bed. So you're more likely to have had a missed pill. Plus the fact that if you've got a bacterial infection, there's a higher chance of you being vomiting or having diarrhea, and either vomiting or diarrhea will prevent you actually absorbing your oral contraceptive and will basically class the same as a missed pill. And therefore, if you have the side effects of your antibiotic of the diarrhea or the vomiting, then again, you may not absorb the oral contraceptives. So although there isn't technically an interaction for the majority of the time, I would say because everything's out of pot at the time and you can't always guarantee that you've actually absorbed your oral contraceptive correctly, then it can always be good to make sure that you've got a second method of contraception. Or let your any of your friends know that it's always useful to have a second method of contraception and not always just rely on the pill. So, oh yeah, I think I've already done all that. Thank you. Really appreciate that. Okay, Ollie, thanks for coming along. There's still probably going to be a bit more if you wanted to come back and watch the rest on replay. So great to have you here, Julie. So I will move on. So the whole topic of probiotics following on from having antibiotics. So yes, having antibiotics does affect your gut microbiome. It can even affect your skin microbiome. So as we've already said, you can use some antibiotics low dose for treating acne to get rid of the acne vulgaris bacteria, get that under control, but it'll allow other bacteria to take over. Yeah, nothing's 100%, and sometimes even when you've got two things that are 98%, it still doesn't make 100%. So yeah. So yes, so your gut microbiome will be upset from antibiotics, and so will your skin microbiome, and generally, which is why we always make sure that you only take an antibiotic if you need to, but there are times when it's need to. So what is best to do about taking probiotics following it? Now, when it comes to taking probiotics all the time, I'll move on to that. But yes, there probably is some evidence that taking probiotics alongside your antibiotics and for the week or two afterwards will help your gut microbiome get back on track. Now, as somebody has already said, when and where should you take it alongside antibiotics? Now, obviously, as you take the antibiotic, it's going to be in your gut, killing off the gut bacteria. So you do not want to be taking the probiotic 2 hours before or after the antibiotic. Now, that can make it quite difficult, especially with some of the antibiotics where you take them 4 times a day, like the flucloxacillin. Could make it difficult sort of fitting it in sort of 2 hours, 2 hours, 2 hours. But then on the other antibiotics where you're only taking them twice a day or once a day, then you could take it sort of 4 hours after, take the probiotic, so that you're giving chance of some good bacteria keeping the balance. Is it crocheting that you're doing, DC? I do like to sit and chat with your lot when you're doing the crocheting. I still can't crochet. Thanks. That is my Christmas tree. I'm a bit annoyed because I cannot find the plug to plug it in and get the lights working on it. Right, now this is when I come to, yogurts. It has to be live yogurt. All of these ones where they say pasteurized yogurt, as soon as you've pasteurized the yogurt, you've killed off the bacteria in it. It's no longer got your good bacteria in it. So it has to be either a live yogurt or a yogurt that's had the good bacteria then put in it. So things like your Actimel, they are not live yogurts. They are yogurt products where they've pasteurized it, done the yogurt products, and then put the live good bacteria in it. Technically, having live prebiotic products such as kimchi, again making sure that it's not been pasteurized, sauerkraut, kefir, and I think I can't pronounce that wrong, and live products, as long as they've not been pasteurized, they are your best sources because they have more of a variety of different different bacteria in it, so have a greater variety for your gut microbiome. Whereas if you've got something like Actimel and such like, they've only put a low dose of 1 or 2 bacteria back into it after it's already been pasteurized. So yeah, excellent. I'm just going to share. So sauerkraut. Now, I have a bit of history with sauerkraut. My nana was Polish. She was rescued from a concentration camp and fetched over to the UK. So every Thursday we would visit my nana, and she would provide us with the pickled carrots, the sauerkraut, and a very nice party pudding that was jelly and angel delight. But yeah, so I grew up remembering that Thursdays was sauerkraut day. And I've still not got a taste for it, but never mind. I've tried kimchi as well. Oh, that was the other one I was thinking of, kombucha. I'm not too keen on kombucha either, but again, they're all very good sources. So when it comes to, I'm going to try and see if I can present, share screen. Hopefully you can all see this website. Oh, hi Rosie. Just noticed that you've come on. So Zoe, Zoe.com. Now, this is a group of scientists and doctors that work at King's College London in King's College London University and the hospital that's attached. And Tim Spector, who is the director of all of this, he started his research originally doing twin studies, looking at non-identical and identical twins to try and work out how much of a difference between them was due to genetics. He then went on to epigenetics, which works out how much of the differences between people of the same genetics is due to their genetics being modified by their environment. So that's your epigenetics. So you've got your genes, but some genes are switched on because of your environment and some are not. So even though something is genetic, and even though 2 twins may have exactly the same genetics, one of them will get that gene switched on because of their environment and the other one won't. He then did more research into this to find out one of the biggest components of your environment that switches your genes on or off is to do with your gut microbiome. So then he moved into doing a lot of work on the gut microbiome. I got to find out is it worked during COVID, because during COVID they set up a whole COVID tracking app, because they already had some of the work set out with the work that they were doing on microbiome and population tracking. They then set up some really good tracking data for COVID, where they literally probably got a good sort of nearly 50% of the UK tracking their households' COVID symptoms and lifestyle symptoms during COVID, tracking it. And they were tracking actually better than the Department of Health were, which is why I got. But they've done a lot of work on the gut microbiome. They have got lots of excellent articles. They are so good at doing articles about the microbiome and probiotics, gut conditions, and everything that you can do. And they are so up to date with the best evidence, and they are continually doing the research. And they've got some podcasts. If you like podcasts, you can sit and listen to their podcasts. They have some that are the short podcasts that are just 10 minutes, where they just super quick, do quick fire questions. They've got ones that are 2 hours, which I love sitting and listening to, which is where I get a lot of this knowledge from. Tim Spector's also wrote a book, and then they also do articles. So one of the articles is do probiotics help following antibiotics? And they did find that there are certain probiotic strains that were effective at colonizing the gut after antibiotics. However, in the long term for the microbiome, people taking probiotics to return, it took them longer to return to normal compared to the people who didn't take the probiotics. So yes, during the treatment with antibiotics and for the 1 or 2 weeks afterwards, it is useful to take the probiotics. And if we go down here, so they're saying about sort of identical twins only share 30% of the same microbes. There's a lot of thing. And the two that you want to be looking out for when you're doing is the lactobacilli and the bifidobacteria. So they're the two that you're wanting to look out for. So when you look out, following you've had had antibiotics, it's caused you antibiotic induced diarrhea or antibiotic associated diarrhea, which is their acronym AAD. It is useful to have a probiotics that's got the lactobacilli and the bifidobacteria to recolonize your gut. However, only for 1 or 2 weeks afterwards, because actually a healthy gut microbiome needs to have hundreds of different bacteria. You know, there's hundreds of different good bacteria, and you need a high variety of those. And to get the high variety of those, you get that from having a good variety of foods in your diet, especially some of those foods that we've just talked about that actually have good bacteria in them, but a lot of them that have got your prebiotics, that have got your fiber and the nutrients that feed your good bacteria, so that you can get that range. If you carry on just taking the same 2 or 3 probiotic bacteria in capsule form or in drink form, you're not providing that variety in your gut, and you're actually going to be inhibiting all those other hundreds of different bacteria, and just those 1 or 2 strains is going to take over. I mean, although there may be 1 or 2 strains of good bacteria that keeping the bad bacteria at bay, for your overall health, having a good range of all of the different bacteria is better. So I hope that made sense. So yes, it can be good short term to take some of the good bacteria and do it. And then I would also say that when you're wanting to do different things with, I'm just going to unshare for a minute so I can make sure I'm keeping an eye on the chat. If you do want to every now and again take some probiotics, go for a different brand each time, so that you're getting different strains, so that when you are replacing in your gut, you're replacing a new strain into your gut. So obviously those 2 are the main 2, the 2 that are classed as the best 2. There's another article on that website which says the 15 best good bacteria, so that the 15 top ones that they suggest. I will leave the links in the description box afterwards. That link's already in there to the main site. I'll leave the links. I can also put them in comments. And then, yeah, and then after you've taken, I'll start again. I've lost my train of thought. So you take a couple, you want to be looking around at different places. And then the other thing that they suggest you do is having lots of different prebiotics. Now, you will get supplements that say they are prebiotics. And although this could be good if you're getting it within your probiotic, basically these prebiotics are just fiber. So they're the same as the ones that are also telling you that they help your gut microbiome, and you see that they're fiber. So they're quite often psyllium husk and inulin powder. Now, if you do suffer with constipation due to lack of fiber, now they are two things that you can include in your alongside while you're trying to build it up in your diet. Add them on as supplements, and sometimes your doctors may prescribe them. But getting them as food is always much more beneficial than getting them as a supplement, because you're not actually, although you're providing them with the fiber, these microbes or these gut bacteria feed on everything in plant foods. So they feed on all the phytonutrients and everything in there, and they require it all. So, right. Oh, thanks, DC. Yeah, I'll probably be watching you later on then. Hi, Christina. Great to have you on here. I think I'm doing well. Yeah, so I've got nine people still currently on, which is great. I love having this interaction. I'm actually finding it's easier for me to plan to do one of these and answer your questions than actually do individual standalone thing. I've got some sort of fly flying around. So, all right. So the advice when it comes to looking at all the different probiotics and the prebiotics, which is basically just the food that the bacteria, the probiotics feed on, you are much better to get them in your food. And actually the data shows that having a larger variety of plant foods in your diet is what's going to improve your gut microbiome the most. And one of the things that Zoe suggests is trying to make sure that you have 30 different plant foods during a week. Now, that can start sounding daunting when you first think of it. I can't fit in 30 veg, but it's not just veg. It's vegetables, fruit, beans, pulses, grains. So even your wheat, your oats, your seeds and nuts. So even if you have something that has got a handful of mixed nuts in it, that's providing lots of all of these micronutrients and such like that your good bacteria can feed on. They've got a really good article there about the fact that coffee is really good for your gut microbiome. So some of the different ingredients that are in coffee, and in a teaspoonful of coffee there is actually fiber. I think they were saying a few grams of fiber in a teaspoon of coffee, and all of the different nutrients that are in coffee, great for your microbiome. Plus green tea as well, some of the ingredients in green tea. So you can see that you don't have to just think of vegetables when you're thinking of increasing up your plant food. And as soon as you start increasing up the amount of different plants, it reduces the amount of junk food that you have within a week, which also helps. I think I got rid of the thing. There was the one that said, which was the, yeah, so the more fibre-rich food. Vegetables, nuts, seeds, beans, pulses. Kimchi, kefir, kombucha, live yogurt, artisanal cheese, sauerkraut. Yeah, so my mum likes all the artisan cheeses. So it's the cheeses that have grown, because that's the other thing. So as well as you thinking the good bacteria in your intestines, you also have good viruses. You also have good fungus, and sort of, you know, you can have fungal infections, but there's actually a lot of good fungus around. You even have some very, very small good parasites. Now, one of the ones is, and this will probably creep a lot of people out, but the majority of people have Dermodax mites crawling on their skin. It is one of the things that actually causes rosacea, which is why treating with metronidazole cream can actually help rosacea. So, yeah. Again, fish. So I will plug my other video that I've just done on omega-3 fatty acids and fish. So fish is very good. The omega's fatty acids in them, because the omega fatty acids actually feed your gut microbiome. Also, fatty acids are part of the metabolism of your good gut bacteria. So another video that I've done is about one of the laxatives that's known as lactulose. And the reason that it works as a laxative is because of the way that it affects your gut bacteria. And it can actually cause an overload of some of the more potent, some of the bacteria that causes more potent gases. So isn't always very pleasant, which is why I don't like lactulose as a laxative. I did find out that it's not really used at all in the US anymore. We need to get the UK on board with that as well. Although they do use the side effect of the bacteria that it breeds to help in people that have got alcoholic liver disease, where you need to help breed those bacteria that eat the ammonia, which is caused from the metabolism of the alcohol. But yeah. So eat the rainbow. Brightly coloured plants are full of polyphenols. So it's the polyphenols which feed the good gut bacteria. Berries, nuts, seeds, extra virgin olive oil, dark chocolate, all contain high levels of the antioxidants and anti-inflammatory compounds, and they all feed the good bacteria. So another reason to eat some nice dark chocolate. So as if I needed any more excuses. Yep, matcha green tea is the best. But yeah, it's all about variety. Lots of variety of all your different plants. And that's what does best to feed your gut microbiome. All of these different places where they try and say that this is the one superfood, or this is the one superfood that we have now processed, ground down, and put in a supplement for you. Unfortunately, it doesn't work that way. Your gut microbiome, your gut microbes prefer to feed on actual food, not just the one or two elements that have been extracted out of one particular food. It's all about having a nice, whole, wide variety, preferably still being in there with the original fibre that it was enclosed in. So as you probably all know, when you have all plants have all the nutrients are kept in cell walls. Those cell walls are made up of cellulose, which is basically soluble fibre that you break down. And part of that process of breaking that down to get to all of the vitamins is what keeps the gut bacteria fed and helps with slowing digestion, so that you can absorb everything nice and steadily. So obviously, sort of as you more fibre, you slow down your spikes of blood glucose. So the one. No, seeds are good for us. A variety of them. What I would say is just concentrating on one oil all the time is what's bad. You don't just have one thing, but a balance of all of them is really good. Obviously, there is the thing that if you overheat oils, that can break things down. It makes your fat, so it makes your polyunsaturated fats more into saturated fats if you overheat them, and that's not a good process to go by. But even the same with coconut. If you burn coconut oil, if you heat that too much, it spoils that. So it's everything within moderation. Whichever you prefer the taste of, I would say. It doesn't have to be dark chocolate. You will still get the benefit even if it's in milk chocolate. It's just that obviously when you're having it as milk chocolate, you're also adding in extra calories because of the fact that they add in so much sugar alongside it. So dark chocolate tends to not have the added sugar, so it doesn't have the added calories to it. But it depends. If you're of a okay weight, there is nothing wrong with having your dark chocolate with milk mixed in it. What I would say is not white chocolate. So white chocolate is made from the cocoa, instead of the cocoa solids, it's made from the cocoa fats. So although it is made from the same plant, it doesn't pull out the same as the polyphenols that you get in the dark chocolate side of it. So so not white chocolate, unfortunately, which I don't particularly like. So I was the child that wouldn't eat the Milky Bar, and I wanted the dark chocolate to make a right mess for my mother. So this was what I was going to move on to. There was another article on here. Let's see if I can present again. Share screen. So hopefully, is it showing? Yes. So this one is all about good gut bugs and drugs, how medicines mix with the microbiome. So there's all the introduction about it. So you've got trillions of microorganisms. It's crazy to think how small they are to how many of them. So there's hundreds of different, well, there can be hundreds, maybe even getting onto thousands of different varieties. But then when they actually start multiplying, you've got trillions of them in your body. To think about how small they are, that there can be trillions. So drugs influencing gut bugs, and as we've already said, everybody's different gut microbiome is totally unique. So the way that the drugs interact with your microbiome can be totally unique, and it can be one of the reasons why different medications can affect different people totally differently, and it's because they're altered before they're even absorbed into the body. So it can actually affect how a drug is actually absorbed into the body, and then that can also change during your life as your gut microbiome health changes during the life. So after a course of antibiotics, you could have been sensitive to one drug and now are not, or you wasn't and now you are. So different things are continually changing. So obviously we've already talked about antibiotics, but the next one that is most likely is proton pump inhibitors. Obviously laxatives, I've already mentioned. Laxatives, you the speed of everything, trying to push everything out quicker, you're not allowing the bacteria the same time to grow, and especially when you're pulling in a lot of liquid into your intestines, that can influence. But PPIs are a big one, and which is why also PPIs is going to be a future video. So normally they're used to treat stomach ulcers, reflux disease, and such like, where there's a lot of acid in your stomach that's either irritating the stomach lining or the esophagus. So the PPIs change the amount of acid that's produced, it reduces it, so it reduces your pH in your stomach, but then that goes and actually affects everything from then onwards and down, which is why they have found that people who have PPIs are actually more at risk of getting C. difficile. That is one of the MHA warnings about people on long-term PPIs. So you've got somebody who's on long-term PPIs, they get hospitalized with a severe infection, they end up having to have, and this is the thing, IV antibiotics still penetrate into your gut and kill your gut bacteria. So you can be on higher doses of the antibiotics through the intravenous feed, but it is still killing off your gut bacteria. And it kills off all the good gut bacteria, and the PPIs lower this acid in your stomach and increases the risk of you getting Clostridium difficile. So that's one of the issues. Metformin has also been shown that it can affect. Now, metformin is one of the best medication out there for lowering blood sugars and helping people with type 2 diabetes lower their blood sugar levels, lower their weight. It also has additional actions in helping lower cardiovascular health, but it does have a slight effect of affecting your good gut bacteria, and it also can have an effect on reducing how much you process and absorb vitamin B12. Well as PPIs also having an effect at maybe reducing your ability to absorb vitamin B12, because vitamin B12 is, the absorption of it is reliant on you also having intrinsic factor in your gut and certain gut bacteria. So there's so many things where it's all interlinked, and we don't really know this. When drugs are studied, drugs are studied to become onto the, PPIs, it's everything that ends in azole. So lansoprazole, pantoprazole, omeprazole, esomeprazole, so rabeprazole, that's all 5 of them. So I think pretty much everybody will probably know somebody on an azole. So so it's useful to know about this interaction, and this isn't something that has been studied very well, because when they study for drugs to come on the market, although they do the pharmacology of how much is absorbed into the bloodstream, they don't always have a look at how it actually transfers through the intestines and its effects on the gut microbiome. They might say that yes, it causes diarrhea, it causes constipation, but it doesn't say that whether that might be due to its effect on the gut microbiome. So I do believe I said I would probably weigh more. So yes, activity is important as part of the energy input over energy output. Unfortunately, the amount of exercise required to burn off calories is not, you don't burn off as much as you really want. When you actually do it, and you do all the whole amount of cardio, and you burn off the same amount of calories as the Kit Kat. The use of being active and exercise is actually much more to do with your heart health, building muscle, because then muscle itself then helps increase your metabolic rate as a whole, so that you actually burn off more calories just being your basal metabolic rate. The more actual muscle mass you have, you will actually be burning more calories on a day-to-day basis. So but there is a big they have done some work on whether there's a whole study on mice, and when they had some fat mice and some thin mice, and this is somewhere on the Zoe Zoe, there was a good podcast that I listened to. So I had thin rats and fat rats, and they took the gut microbiome out of the thin rats by taking a stool sample and then putting it and injecting it into the intestines of the fat rats, and the fat rats ended up losing weight because they were all fed the same amount. It was just there were some thin rats and some fat rats. And then they also did the same. They took the microbiomes from the fat rats and put it back into the thin rats, and again, then they gained weight. So there is some evidence that actually what your gut microbiome is indicates your whether you can lose weight or gain weight. Now, then that leads into is it a cause or effect that people have good gut bacteria that causes them to lose weight? Is that because of they've got that gut biome because of the foods that they eat, or is it the other way around? Now, there needs to be a lot more to study, but it is very, very interesting. There has been, when it comes to stool transplants, this has been a thing. So obviously they're finding out that certain people have some good gut microbiomes, and then some other people, especially people who have had different diseases, maybe people with ulcerative colitis and such like, and they're doing research on doing fecal transplants from healthy family members over to the unhealthy family members. So maybe they've had a family member who has ended up with a really bad case of C. difficile after having whole loads of courses of antibiotics. And so they put a fecal transplant from a healthy family member into the other family member to try and restart the process. Now, there's two ways of doing that. You could either be putting it up there with a colostomy, with a colonoscopy or such like, or there is what they have now termed where they make capsules. So basically they take the microbiome, the gut microbiome from a family member, they process it, they sort of put it into a capsule, and then the other family member takes that capsule. So it has been done, but only a few times. It's a long way before that can be actually sort of made into a proper process. So it's a bit like blood transfusion from a family member. You can have a bit of their gut microbiome. Obviously, there's probably not many people out there that are willing to try this, but things. So, yes, thank you for the red Christmas tree. I was also going to say, because I can't really see it on here, I did wear my Christmas jumper, so I've got sugar and spice. So I tried to be Christmassy and then realised that it doesn't actually show up on the computer. I need to actually get some Christmas decorations. Yeah, we really do need to get the information out there about the gut microbiome. Yes, gut microbiome is extremely important, but there's no quick fix. There is no one product that helps. It's all about lifestyle changes, increasing up all those foods that have got prebiotics in, all of those foods that have got probiotics in, and having a thing. And as we've found out with all of these products, they always try and say that the results that they get is because of the products that they've charged hundreds of pounds for. But we all realised that they also provide you restrictions on what you're eating. So they tell you to restrict certain foods, and then you're adding in the foods that are the ones that are good for your gut microbiome. But it had nothing to do with what they were selling. It's all to do with the extra hydration that they tell you that you need to do, and the extra foods that they tell you that you're only allowed to eat. But they actually restrict it far too far. So if you talk to any dietitian, you shouldn't actually restrict anything out of your diet unless you actually have an allergy or an intolerance to it. You just need to make sure that you've got everything within moderation and a variety. I have had a flood of comments, so I'll see if I can cut up. Oh, 1.5 hours. Oh, that is excellent. It's excellent for the dog and for you. How does the capsule not get destroyed by stomach acid? That's an excellent question. Right. So majority of tablets and capsules that you take, once they hit the stomach acid will start dissolving them, and you will start absorbing them as soon as they hit the small intestine. However, there's quite a lot of drugs out there, and obviously these bacteria that will get killed by by stomach acid. And so a long time ago, decades ago, they actually managed to work out how to coat either a capsule or a tablet with what we call an enteric coating. So the enteric coating, it is a coating that will only dissolve when the pH rises above about 6 or 7. So it will only rise once it gets into the small intestine, and all the bile acids and such like, well, not the bile acids, all the other gut juices in there raise up the pH to 7 or 8. So as food goes through the intestines, firstly it hits the pH of 1 as it hits the hydrochloric acid in your stomach, because that breaks down certain things out of plants and animals. And then as it goes through each stage of the intestines, it changes the pH up and down so that different foods, different nutrients get dissolved and get absorbed. So with the enteric coating, while there's a pH of 1 or 2 in the stomach, it doesn't dissolve. And then as soon as it gets past that and the pH rises, it then dissolves. So that is why whenever you see a tablet or a capsule that has an enteric coating on them, they will all say, do not take with indigestion remedies. And that's because indigestion remedies are medicines that actually neutralize the pH in your stomach, and therefore will automatically cause the coating of the tablet to break down too early. And you never know whether, although you've taken it at the same time, whether that pH then goes up and down and things get destroyed. So yeah, there is ways and means to get over stomach acid. Yeah, so that's the problem with endometriosis, is it's the fact that it's the uterine lining has gone everywhere it shouldn't in the abdominal cavity, and that's why it can look like irritable bowel disease. I actually managed to diagnose a friend's daughter, because she was explaining to me all the symptoms that her daughter was having, that they were trying to say was to do with the bowels, but they couldn't find anything on investigation. But then she knew it was worse at some parts of the cycle, and so I said, well, get them to look for the endometriosis, and got a referral to the gynae instead of the gastro, and that worked. So sometimes it's just getting the right doctor to look. Excellent. Yeah, I love this Christmas jumper. It's my favorite one. Yeah, that's why it's called a crapsule. I think that name's excellent. They do call me the poo queen at work, because I love everything gastroenterology. I love everything to do with laxatives, learning about the gut microbiome. Yeah. So yeah, so it's all about doing that with a registered dietitian. So yeah, if you've got food allergies or intolerances, or you think you have food allergies or intolerances, it's always worth doing it with a healthcare professional on what you can take out and what to add in and when to do that, so that you're making sure that you're not missing out on all your micronutrients. Because although it could be very useful to get rid of all FODMAP foods out your diet, you're then removing everything that your good bacteria needs. So even though it's feeding your bad bacteria, it could be feeding your good bacteria. And also the fact that all your fruits and vegetables and everything is everything with all your micronutrients in. So your B vitamins, the lesser minerals such as your selenium and chromium, all the ones that they try saying that they need adding into the supplements, the expensive MLM supplements. They're all in all your sort of seeds, nuts, vegetables, fruit. Yes, it was. I just that's why I've started this channel. So many times I just love helping people, so I do it all the time at work, giving out the advice. I've got so much knowledge in my head, and I wish that it could get explained to everybody. So easily. People seem to want to gatekeep all this scientific information. A lot of the doctors don't seem to be able to explain it in a accessible way, and we need to get this information out there, accessible to everybody. But there's too many companies out there that are wanting to make money out of it by giving incorrect advice, selling products, when actually we need to be able to help people take control of their own life. Hi Sam, I don't know whether you was on one of my previous live streams where I said that pineapple can cause anaphylaxis. Pineapple and some other fruits like kiwi have what are known as a latex enzyme in them. So people that are allergic to latex can be allergic to pineapples and kiwi, or vice versa, because of the latex enzyme in them. So if you were to look to Google latex enzyme fruit, or those three words, you'll come up with articles about which fruits contain the latex enzyme. And there may all be ones that you want to sort of just be careful with, as well as actual latex. Obviously. Yeah. So so they do, when they do say, because they do cut out certain foods that do cause certain problems, and so that they can sort of make out, and then they say you have to drink your 2 liters of water, and we all know that just increasing hydration is going to cause a massive improvement for the majority of people, and the majority of people that get sucked into these need that. So yeah, just keep an eye on it. So that makes sense. You may have some genetic component to have allergic components. I'm not too up on the genetics of allergies. I do know that a lot of people with Ehlers-Danlos syndrome, the same as me, are more likely to have allergies and things like the mast cell activation syndrome, which is allergies to a lot of different things. But yeah, that's it. So I think I've covered quite a lot on different things around antibiotics, gut microbiome and probiotics. Hopefully I've answered most people's questions. If I haven't, then please feel free to put comments in after the live stream is finished in the main comment section. I'd also appreciate it if you could go in there, maybe I don't know, if you could put pineapple or kiwi in the comments once this is closed, to try and get that YouTube algorithm engagement and see if we can get pushed out. My last YouTube live, for some reason, YouTube loved it, the subject of migraine, and it actually put it out to 2.6k of people, which I have never had before. For some reason, YouTube loved it, and I actually spread it out to so many more people. So if we can get the YouTube algorithm to do that again, yeah, if you could link the stream, that would be great, because we do need to get this message out there. And the more people that we can get joining these streams, the more questions that I can answer, we can get that information out to more people. And hopefully I can eventually monetize this as well. So make it worth my time, and I can buy some equipment. That's what I'm only planning on doing. I'm not going to be doing this to earn earn money. I still want to keep my few hours. I work 24 hours for the NHS. I want to always keep that going. But it would be nice to be able for YouTube to pay itself to pay for some better equipment rather than me be just sat in my kitchen. I'd be like to be able to sort of set up another room, get some proper lighting, get a proper mic, so I'm not sounding like I'm echoing around the kitchen, get some proper lights, because the reason I'm in my kitchen is because of these LEDs. So that would be good. But thank you so much. I've got up to 11 people on the stream. Really enjoyed having you all here. DC, Ranger Lab, Patricia, Sam, Rosie, my mum and dad, everybody else that's if they're still on, Sam. So yeah, great to see you all here, and I'll be on again in 3 weeks' time. And as I said, I will cover laxatives on that stream, so there will be a bit of overlap to what we've talked to here. But get your questions ready, send them to me, and I'll make sure that I answer them all. Thank you very much. Thank you. Yeah, have a good day, everybody. See you later on your stream, DC.